Hello, I'm Solomay Tibabu, the host of the Going Digital Behavioral Health Tech Summit, and I'm so thrilled to have Shana Hoffman here. Thanks so much, Shana, for being here. Would be wonderful if you could start out by offering a brief introduction.
Salome, thanks so much for having me, and thank you for all the great work that you're doing around behavioral health. We are great cheerleaders for your organization, so glad to be here. Just by way of background, I've spent my whole career in the healthcare space, a mix of large companies, was in dialysis services at DaVita for some time, and then have done kind of earlier stage tech startups, really in the patient access space, ran my own company in the senior care space, and then spent the past few years working in behavioral health, was at Beacon Health Options for some time, and then started here at New Directions as CEO about 6 months ago, and really excited to share a little bit more about what we're working on here today, and really trying to deliver better high quality care to our members and their families.
Awesome. Well, this is a super exciting new chapter. Your leadership, the changes at New Directions coming soon. We'd love to hear more about what's on the horizon and what you're excited about.
Yeah, so I think I'll talk about what I'm excited about from two perspectives. So I think from a industry perspective and kind of from a client perspective, there's just been so much positive energy that was going on around behavioral health. Obviously, the pandemic's accelerated that in a difficult manner. But I think for me, coming out of this, I think we're going to just really think differently as a country about behavioral health, and really think about it holistically as part of preventative care in the same way that we would think about measuring someone's vital signs at a visit. We would think about kind of the behavioral health component, because I think as we've seen, it was something that was somewhat neglected, and there were not some of those kind of tools and resources that people needed to deal with what then obviously came once in a lifetime type of thing with the pandemic. And so I think from an industry perspective, there's just so much going on and energy to tap into that's really positive. I think from our own organization, what I'm really excited about here, some folks may or may not be familiar with New Directions. We actually have been around for 25 years, owned by Blue Cross and Blue Shield plans, have some really large plans where we deliver high quality outcomes. What I'm most excited about is the team that we've been able to assemble to build on those 25 years of experience, tremendous amount of know-how and knowledge around clinical and operations in our organization, and being able to bring a new team to the table from a leadership perspective with a lot of expertise, both in behavioral health and then more broadly in healthcare in other areas such as palliative care and such as other areas that I think have undergone certain transformations that can bring a lot from a measurement-based care perspective, if we think about dialysis, to kind of come to behavioral health care. So I think both macro from an industry perspective and then within our own organization, there's just a tremendous amount of excitement we have about our next chapter here.
That's incredible. And you've covered this a bit, but you really have such a unique vantage point with working with so many Blues plans and beyond. What are some of the needs of those clients, and what have you seen in the last year, and how is New Directions supporting them?
Yeah, so it's a great question. I mean, I think what we are most proud of is those health plan relationships that we've had over the years. I think what we've seen lines up a little bit to what I talked about in the industry is I think there's very much a recognition for each of these health plans that they have to have a strategy and have a plan around behavioral health. It really can't be seen as kind of a secondary thing that is, smaller dollars, and so therefore doesn't matter as much. I think there's been this realization that one is so much more of a driver of overall health outcomes and kind of healthcare costs more broadly. And so in that, they are working both from their own perspective as well as seeing with their large employer customers the need to figure out what they're going to do from a behavioral health strategy perspective. And that actually is at the forefront, right? That's what employer clients are asking them to lead with in some cases, which is just really unique if you think about sort of the evolution that behavioral health has gone through over time. And so we feel like it's a unique opportunity for us to kind of be by their side in partnering on helping support them in those needs. The other thing I would say that's been interesting from a pandemic perspective is kind of moving this shift to think more broadly around the population in terms of members that need access to services that are self-identifying. And there's always been this need to try to connect those people to care more effectively and drive access. But now also thinking, how do we use data within the population to look at who may be struggling and maybe either undertreated or not in treatment and can benefit from services. And so we've partnered with our plans and some really cool programs around cancer, pain programs, where based on the data, we can know who may be in need of services. We see high degrees of overlap with chronic disease, for example, with behavioral health. And so just a really data-driven approach that we're partnering up with our health plans to kind of drive those outcomes. And I think, it's really just a powerful sort of new way to kind of get to people. I think specifically on that, and this is something that, has been kind of a staggering statistic with the pandemic, has been a real drop off in members with substance use disorders that are in treatment. And so we have seen, that they had a substance use disorder diagnosis and now are no longer have claims with being in treatment. And so again, just using that data to be able to figure out how do we get to some of those people, because, as people talk about, there's this second wave coming, and I think we're even seeing it from a data-driven perspective. So that really speaks, at a high level, I think, how our plans are thinking about behavioral health differently, which is really great. And I think the Blues are leading in many ways in these areas. And then, also some more of that, what that looks like for us in practice.
Speaking of evolution and acceleration, can you talk a bit about how the acceleration in virtual care has changed how your members get treatment, and really what are the impacts of virtual care on access challenges and anything else in that regard?
Yeah, so I think, as everyone knows, there's been such an acceleration in virtual care because of the pandemic. And I think behavioral health was always a particular sector that was ripe for it, right? If you think about the nature of a lot of the behavioral health treatments, they are something that actually can be done better in someone's, comfort of their own home via video type of chat situation. And so I think it's always been ripe for that type of service. Obviously, there's been an acceleration given the pandemic. One of the really cool things I think we've seen is for certain types of treatment. So if you think about substance use disorder treatment, think about eating disorder treatment, think about OCD treatment, right? There now are virtual mechanisms to treat that. And I think there's been so much more acceptance because there's not been the ability in some of those cases to be in a physical setting. And so I think it's really accelerated the acceptance. And then I think the clinical outcomes we've seen in some of those programs actually, in some cases, exceed what you have in a bricks and mortar experience. And so we're really excited about that because I think it also helps as you think about access challenges. The ability to do that supply and demand matching is easier, obviously, with virtual care, where you're not trying to match, a zip code and a person's drive time, right? But can actually connect them to someone who, may not be located in their state, may just be licensed in that state. And so it's sort of a helpful equalizer with regards to supply and demand. And so I think, again, if we think about silver linings of the pandemic, I think this is an area where there's really been a lot of great innovation that is now getting traction in a way that I think would have taken a lot longer had the pandemic not occurred.
Totally. What are other ways that New Directions is integrating technology and digital health specifically to support your health plan partners?
Yeah, absolutely. So what I didn't mention is I'm actually an engineer by background. And so people who talk to me a lot hear me talk about people, process, technology, and venue. And fundamentally, I think in healthcare, and so much of the work we do is such a human to human interaction. When you see the stories of outcomes we drive with members, there's such a human kind of component of that. And so I think about technology really in the context of enabling that human interaction. And so I'll give you an example. We have in a lot of cases, members that have a lot of co-occurring medical and behavioral health conditions, right? And so what we are doing is partnering up with our health plan, and we have care managers on both sides. But where we think about technology is perhaps we have a member that's got COPD kind of side by side with an OUD diagnosis or opioid use disorder diagnosis. And what we're able to do is connect that person maybe for a consult with a telehealth provider for their COPD, and then also connect them with a provider for their substance use disorder. And so if you think about that, now you have someone that's able, again, from their own home to be able to get all these different treatment mechanisms to be able to meet their needs. But really what's also going on is two human care managers that are interacting with that individual very closely to understand what are the goals of care, what's going on, what's the actual underlying reason for that opioid use disorder. And so I really believe technology is just this great enabler in the context of that kind of people and process. And that's why, we do have such a large number of clinicians at our organization that do that human work. And we try to think about technology in the context of how is it going to accelerate or get someone connected to care differentially, get them directly scheduled in versus providing names of providers for referrals and things like that. So that's really, what I'm excited about. And there's obviously no shortage of innovation going on in behavioral health. And I think it's for us about plugging that in so that we're getting, members more reliably connected to care.
So if you had a crystal ball, how will behavioral health look differently in 5 years from now?
Yeah. So good question. I think ultimately, I really do think that this trend of integration, really from the perspective of behavioral health being integrated into how we think about kind of whole person care, is going to continue to evolve. And so I really do believe, that we will see the same way when you go to that physical visit that you're having, your blood pressure checked. I really do believe mental health screening will be 100% a part of that. I think it's in our industry, and sometimes I think it happens more than it does. My husband happens to be a physician, happens to be a lung doctor. We've gone through a pandemic, and at his most recent PCP visit, there were no questions around mental health screening. And he said, I know I would have, screened high for a variety of things, just for what he's dealt with in caring for patients. And I think in the future, we will have that 100% baked in. I think people will just have a recognition that you're not really treating the whole person if you're not actually asking those questions. I think another area is around measurement-based care. I think there will be much more evolution in that, where we are thinking really about matching that patient to the right provider with them, the same way that there's such specificity for orthopedic doctors, for example, with hips and knees and shoulders. The same level of specificity, I think, will come to behavioral health with an outcomes-based approach to say, okay, how do you do with patients of a certain type with a certain condition? And so I think that's going to be something that's going to really evolve over the next 5 years. And I think we really might not talk about behavioral health and physical health so differently in the way that we do today, right? I actually think, it maybe become, and that's a good thing or a bad thing, I can't really decide, but I do think that there's going to be just this complete realization that those things are inextricably linked, and that will just continue over the next 5 years.
So you alluded to data earlier. How are you leveraging data to drive good outcomes and services for end user members?
Yeah, so we have developed kind of what we call the ICM, not integrated case management, but identify, connect, measure model, where we are really using data in that identify lane to determine members that, again, may or may not be in treatment. So we have, for example, members that might have a substance use diagnosis, but may not have medically assisted treatment claims for them, where we know that we want to get them into medically assisted treatment, or perhaps they have an antidepressant or an anti-anxiety med prescribed, but don't have behavioral health claims side by side. And so there's all these different permutations that you can look at when you look at kind of medical, pharmacy, behavioral health data together that can help guide you to determine members that may or may not be accessing services that can benefit from those types of behavioral health services. And so we're really using that data to be able to drive connecting members to care. When we think about kind of connecting members to care, it's also a data-driven approach there in terms of understanding what are those needs. And I think, again, we want to get more sophisticated at what are the types of populations that do better with certain modalities. I think there will be a lot of opportunity to kind of test, who might be better suited for a hybrid model of being both face-to-face and a digital component. Where are there options that are digital components best? And then there will likely be, some portion of the population for whom being in person is going to be the right mechanism for treatment. So using kind of the data to help us identify from an outcomes perspective when we look at who we've ID'd and connected, how are they improving both from a quality of match of how well are you gelling with the provider? Are they meeting your needs kind of from a cultural, from a diversity perspective, and wanting to get, much more sophisticated there? I know there's been a lot of innovation in that area to ensure that, that the provider side reflects kind of the population, and we're doing some of that work as well to make sure our network reflects kind of our members in our particular markets. And then kind of from a quality perspective in terms of an improvement in a clinical outcome, such as a PHQ-9 or a GAD-7 or some of these standardized assessments, and then from a total medical expense. So it's kind of this feedback loop where data is really at the core of everything we're doing. And I think that's been something where we've certainly identified people that were not in treatment. We've gotten them into care, sometimes even intensive case management. And there's been really, really amazing clinical outcomes. And again, kind of that total medical expense following. It is important that we, talk about just wanting to do the right thing at all times for the member, and knowing that sort of savings measure will follow versus kind of the inverse being true.
Wow, that's remarkable. You're doing so many cutting edge things at New Directions. This is clearly a very exciting new chapter. Thanks so much for your time, Shana. I wish we had more, but we're already having to wrap up. And so thanks again for sharing all this with our audience.
Absolutely. Really, really appreciate the time and the opportunity to speak with you today.